Okay, so that is my sign that I can get started. And welcome everyone to this panel discussion this evening. So hi, my name is Lynette Ford and I am the Chief Program Officer at The Door. Thank you all for joining us tonight. I am so excited to be moderating this panel and to spend some time exploring The Door's approach to one of the most important topics in today's world, mental health. For those of you who are less familiar with us, we are celebrating an exciting milestone this year, 50 years of operation. The Door was established in 1972 with the vision of creating an innovative youth development model to address the complex needs of young New Yorkers. I am proud to say that today we serve up to 11,000 youth annually across our 4 New York City locations, including our main site in Lower Manhattan, our supportive housing sites on the Lower East Side, and our satellite site in the South Bronx. The Door's success lies in our commitment to meeting young people where they are and providing them with the comprehensive and integrated services they need to reach their potential. At The Door, youth can access everything from healthcare and education to mental health counseling and crisis intervention, as well as legal assistance, high school equivalency and college preparation services, career development, housing support, arts, sports, and recreational activities, as well as nutritious meals, all for free and in a diverse, caring, and supportive environment. Broome Street Academy, also known as BSA, a charter school embedded at The Door, enrolls up to 330 students and prioritizes applicants who are experiencing housing instability or who have been involved in the child welfare system. The wraparound services provided in partnership with The Door promote student success in school and in life. The last few years have marked an explosion in awareness and discussion of the importance of mental health support. But at The Door, we've always emphasized creating environments that support the social and emotional well-being of the young people we serve. We design creative, approachable, and accessible engagement points for young people at varying degrees of readiness to engage, and work hard to integrate supportive conversations and spaces into all of our programming. We are joined today by a diverse group of our extraordinary providers who will talk more about our unique approach to mental health support and The Door's impressive continuum of care. So with that, first I would like to introduce Steph Cadet. Steph is the Assistant Director of Clinical Support, a licensed mental health counselor, and Steph has been at The Door for 6 years. They have a strong interest in non-traditional mental health modalities, supporting LGBTQ+ youth and crisis intervention. Steph, thank you for joining us. Can you tell us more about your work?
Yes, good evening, everybody, and thank you, Lynette, for that introduction. I'm excited to be a part of this panel and grateful to share this platform with my colleagues who I've had the privilege of collaborating with over the past few years. My work at The Door is really focused on supporting young people outside of the traditional clinic model. I sometimes call it incognito mental health support. The first floor of our building at 555 Broome houses our membership and intake programs, our runaway and homeless youth programming, and our center space or community space. It's really the first space that young people spend time at The Door, and it's where we get to know everyone's needs and have the opportunity to build strong relationships.
Wow. Thanks so much, Steph. It's such an amazing space. I've only been at The Door for 3 months, and I have to say, every time I walk through center space, I get a bolt of energy. No Red Bull needed at The Door. I've really been enjoying seeing it come back to life and starting to get a good feel for what The Door's community is like. Steph, how do you use this space to support young people?
I definitely agree, no Red Bulls needed. In center space on the first floor, The Door in general, we embed a lot of mental health support into those programs to make sure that we're supporting young people who might otherwise not make it to more formalized counseling settings. We're doing a combination of crisis work, responding to immediate and acute needs, and ongoing community building and support. We work hard to build trust with young people, many of whom have had bad institutional experiences where they have been criminalized or hurt in other ways. Rebuilding that trust can take time, which we are invested in. Mental health support is always happening in our space. It just doesn't look like more traditional models of psychotherapy. Our initial approach is all about engagement, relationship building, and consistency. So we do it in fun ways, like shooting around with a young person or making art or playing ping pong. So often that distraction relieves anxiety and helps a young person start to talk and connect. We do this to make it less formalized and more fun. We really focus on short but frequent check-ins to build trust because we know that the research shows a strong connection to a caring adult is one of the most protective and influencing factors for a young person. At the door, we really just try to send a message that we're here for you and start conversations about feelings, process current events and traumas, and working on helping young people learn to contain those feelings in a safe way. We also provide a range of group support spaces, such as grief support, healthy relationships, anger management, as well as a range of groups for Spanish-speaking young people. We recognize how important it is to have folks with a wide range of identities in these supportive roles and folks with different experiences so that young people can find someone they feel safe and comfortable with. We really try hard to create a lot of different ways for young people to find community. We want to help young people understand that they are not alone.
Yes. One of the things I took from your discussion just now, Steph, is you said, I am here for you. And I think when we think about young people, I read a quote the other day where it said, working with young people is more about them understanding they don't care what you have to say until they know you care what they have to say. And you saying, I'm here for you, I think encapsulates that. How has this been different during the pandemic?
One, definitely agree that young people need to know that you're there for them. And that looks different for every young person. Specifically during the pandemic, the difference and some of the difficulties has been creating community over the past 2 years. We did our best to create online touch points to make sure we are open for young people to stop by if they needed to talk or connect, and some to connect to someone, and have tried to provide lots of resources and information along the way. We unfortunately lost touch with a lot of the young people who were in betweens, meaning not yet strongly connected to any one person or program. We worked hard to find them and reach out if we had contact information, and did things that was new for the door, like build a text line to stay in touch. We're definitely excited to be more fully open now and are starting to see young people return and reconnect. We all feel grateful to have young people back in the space because, as you said, no Red Bull needed. As folks start to return, we're also focusing a lot on giving young people the tools they need to support each other and their communities in more meaningful ways. We're really emphasizing at the door the importance and power of communal and collective care.
Wow, Steph, I could honestly talk to you all night. These are all such wonderful ways to support young people. One final question before I let you go. How does this fit into our broader continuum of care at the door?
So the continuum of care at the door, aside from being a space and a range of programs that initiates conversations about mental health and feelings, and that breeds connections, we look to make sure that we're a community that provides opportunities for young people to practice these skills they're working on in more formal therapy, and supports young people in preparing for longer term work. We focus a lot on helping young people to stabilize emotionally and physically so that they can move through the hard stuff and start to move forward.
Excellent. Thank you so much for sharing that unique perspective, Steph, and for all that you do for young people at the door. I definitely think that all of that in-between work, as you called it, is so important, particularly for adolescents, and it is so unique. As we continue to think about this continuum of mental health support, I'd like to introduce Sarah Armstrong and Phoebe Richmond. Sarah is a nurse practitioner in the Door's Adolescent Health Center. She started at the Door many years ago, in fact, in 2006, in the Member Services Department. She left to pursue nursing school and then found her way back. She's been in the health center for 7.5 years now and has a unique perspective on the Door's integrated model. Phoebe is a clinical social worker and has been at the Door since 2014, where she started as a social work intern in the Runaway and Homeless Youth Program. She is the clinical supervisor in the Door's Counseling Center. They'll share a bit about the Door's more formal mental health programs and our collaborative care model. So Sarah, why don't you start us off?
Thank you, Lynette. It's an honor to be on this panel. I believe I was included as another example of the way mental health support is provided at the Door, being one of the only people on this panel that is not formally trained in mental health. I think I have gotten a lot of experience in the time I've been there. And as a fundamental part of the way the Door started, I think interdisciplinary collaboration is fundamental to what we do. So it's really great that I'm being paired with Phoebe for this part of the panel. We've worked together for almost 7 years. I have a great deal of respect for what she does. As far as my practice, I'm a medical provider who really believes in the holistic approach to care. I think that it's been a fundamental part of the work that I do to see them as a whole person, to talk to them about their psychosocial needs and history, as well as their current life circumstances, their past trauma. And because of that, I think that creates a safe space in the exam room and can kind of normalize and destigmatize what it looks like to kind of open up about some of these things and then ultimately connect to mental health services in a more formal way. And I think that's been a kind of great part of the way the health center works, because we have had a social worker directly in the health center, but we also have a wonderful counseling department. We have wonderful people like Steph and other staff supports in other areas of the building that we can provide kind of direct contact with after a medical appointment is over. So I think that's been wonderful. I think that it's also been really helpful to be able to know that we can start those conversations, feel supported in the ability to kind of have young people get sort of what they need at the point that they're ready to share and what they're telling us.
And I think, yeah, it really goes along. Hi, everybody. I'm Phoebe. It really goes along with what Steph was talking about with kind of like the incognito mental health piece, and that a lot of this does kind of happen organically and it happens on the fly. And the most powerful thing that we can do as staff people at the Door, whether we're formally trained in mental health care or not, is to kind of build that trust with young people and give them the space and time to sort of bring those things out when they're ready. And sometimes that can originate kind of anywhere along the flow of a health center visit. So like I was there as a social worker in a formal capacity, Sarah's there as one of our medical providers, but sometimes these conversations start with a medical assistant. They come in, they say, what brings you in today? And like that opens up this whole conversation about what's going on with them in their relationship, what's going on with them in their home, that then can kind of alert the staff to mobilize these other supports that we have that are a little bit more formalized. And just the way that our staff are really like mission driven and really bring the Door values to whatever avenue of the visit is like their stop along the way.
And I think that level of collaboration also has been great, that each touch point in the health center, in addition to the building, sometimes people are brought down directly from member services, would have found Phoebe several years ago, and now it's a little different, or found from a front desk, to be able to create the type of appointment they needed. And based on the structure that we have, we're asking a lot of these kind of hard-hitting questions earlier in the visits, but we sort of leave space for people to answer what they're comfortable answering. So sometimes day one, they'll open up about a great deal of things in their very first exam when they came, asking potentially for just a physical for sports for school. And in other cases, it takes several follow-up visits before they realize, they're ready to kind of open up, and that can be a great opportunity for us to sort of link them to other services within the building.
Thank you so much, Sarah and Phoebe. I just wanted to call out that we have one of the founders of the Door, Don Shapiro, on the call. And I know his heart is skipping a beat hearing about all of the wonderful work that he laid the foundation for, and how all of you are symbolic of that community space and community help. And so we hear a lot about collaborative care these days. Can either of you or both of you tell us a little bit more about what that means?
Absolutely. So collaborative care was designed as a way to really increase access to mental health care There are so many barriers to accessing kind of the more traditional mental health model of like individual psychotherapy or psychiatry. There just aren't as many providers in a lot of spaces. There's a lot of stigma around accessing kind of formal mental health services. So this model was it was designed as a way to bring those services into the primary care space where people are really showing up and maybe bringing some of these issues to their primary care providers. So it's really a partnership between the primary care provider, a psychiatric consultant, and then a behavioral health care manager, who in our case is a social worker, who really kind of rally around the patient. And it's really individualized. It's really kind of tailored to what the patient needs in the moment of kind of figuring out goal setting, figuring out what they want to shift in their life, what they want to focus on, ways that they can sort of shore up their own coping mechanisms and ways to really manage their mental health on their own. With the psychiatric consultant, we also kind of have a place to go if we are prescribing medications, antidepressants, anxiety meds, and we can kind of talk through any complications with that with the psychiatrist. But really it leaves the primary care provider as kind of like the main touch point for that patient in their mental health care.
And as I mentioned a bit before, this can come up in what we consider a routine visit. So sometimes people will walk in and say that they're really interested in starting birth control, or they're really interested in a physical exam for working papers, or they're having a symptom that's concerning to them and they would like to be examined. And then more will come up, and it will maybe be around the current crisis that's kind of evolved into something that they want further support with, or just general coping that they would like to kind of address and make healthier. So I think that it's, the warm handoffs, the ability to sort of establish trust with the patient, but also highlight the trust we have for one another. And I think part of that interdisciplinary work, it's what's so vital about it, is that we really trust the skill sets of the people that we work with at the door. And we're able to hand off in a very confident way by saying, I really trust Phoebe. I really trust Steph. I think they're going to be able to help you with this part of what you need. And the collaborative care model is a more formalized way of us being able to provide that care for people that might not be ready or ever want therapy weekly. Like there are some people that just want to touch base maybe once every other week to say, I'd really like to think about a way to be a little bit more calm in moments when I'm scared, or when I'm in this setting, I notice that I have such a great deal of anger. I'd really like to work on how I might feel differently. And when they're brave enough to share that with us, it's really great to be able to have a concrete way to provide them support.
And it is so interesting, when we were first learning about collaborative care as a model, it felt like such a natural fit that it was like, oh, there's a name for what we already do. And a way to, get reimbursed for it, which is fantastic. But yeah, that like, it's so just like hand in hand with the DOORS model of this integrated care, and really just being a holistic team around our young people.
Thank you, Sarah and Phoebe. And Sarah, hearing you speak, it brought up a conversation that we had as we were planning this panel discussion tonight, where you talked about dinner being a really prime example of meeting young people where they are. And as you know, in NP, it makes it a lot less scary to make an appointment with someone when you joked with them over the previous day about lasagna. So I just thought that was a funny story, but more highlights that connection and meeting young people where they are and building that trust and rapport. We talked a little bit about the counseling program. Can you talk a little bit about how the counseling program and the clinic fit into this continuum of care?
Absolutely. So along with kind of the mental health that's built into our primary care side of the clinic, our adolescent health center also has a full panel of outpatient mental health services. So the bulk of our work is really individual psychotherapy, but we have, we've had therapeutic groups over the years. We've done a lot of crisis intervention, support for staff around mental health, and supporting young people. It's really hard to describe kind of who a typical client of ours is. Really, like our only criteria for care is that they're between 12 and 24. So we really just serve like the entire range of youth of New York City. So, we might have a 14-year-old who's really just coming to talk about some social issues that they're having at school. We might have a 22-year-old who's hearing voices for the first time and isn't really sure what's going on with them. And so we really try to stay grounded and being really client-centered and just meeting each young person where they are when they come to us. So that is kind of our more formal mental health. I know Dr. Aaron is going to talk a little bit later about how psychiatry fits into that. We do have psychiatric support as well. And we built some mechanisms throughout the agency. So as part of this continuum that Steph was really introducing us to, we've built social work support, mental health support into each program at the door. So folks are there to kind of address immediate needs, address crises that come up, make linkages to the counseling center. And we also have sort of brought those folks all together in a collective to provide support to each other, to kind of have a group processing space, and also to do more like specific trainings about different mental health modalities, kind of keep updated on best practice, make sure we're really all on the same page of how we're supporting young people.
Thank you. I think we can all agree that the last 2 years have really highlighted the need for more connection and more mental health support. How have we responded to that need and the challenges of connecting during the pandemic?
Absolutely. I think, a tenet of adolescent health to begin with is sort of recognizing that their greatest health risk factors are behavioral and sort of mental health and their life circumstances. Not many are coming in with chronic health disease. And particularly in the last 2 years, it has been, it seems as though it has skyrocketed in terms of needing mental health support. And so I've actually seen, my colleagues in the health center have seen an increase in outreach and requests for additional mental health services. And I think it's actually been wonderful that it's been destigmatized. I think a lot more people prior to the pandemic, adults as well, would have benefited from having a touch point, a person to just sort of be able to process with. And it's been great that we have been able to have the counseling staff that we have and the other supports within the building to be able to provide that now that more people are asking for it.
And yeah, like many clinics across the city, we do have a wait list right now for our services. It continues to be a really highly requested service for people coming through membership, people emailing us directly, really looking for support in a way that feels different since COVID started. And partly because of that, we're actually in the process of applying for a new mental health license that would really help us expand some of those services. So we're really hopeful about that, and really grateful for kind of the milieu care that we have at the door and the ability to just be a group of caring adults for young people, whether we're formally trained in mental health care or not. We can sort of hold space, we can listen, we can bear witness in a way that I think is really meaningful right now.
Sarah and Phoebe, it's clear that you two really trust and support each other. Such a wonderful example of that trust we've been talking about tonight. How does that impact the way you work with young people?
There are tons of examples that we have in preparation of this panel. As I said, Phoebe and I have worked together now for almost 7 years. And you mentioned dinner before. So there were a lot of kind of informal spaces that we, as staff, prior to the pandemic a bit more, but we're trying to sort of reintegrate this, can interact with young people, like going to open mic or sitting up at dinner. And through that, many of us are able to sort of bring our own personalities and our own skill set to engaging them. And there's one person in particular that Phoebe and I kind of came to mind today, actually after a conversation with Steph as well, that we've all worked with, who is a sort of a very classic young dorm member who's aged out, who was sort of systems involved with foster care and had housing instability, sought out services in the health center, was seeking high school equivalency, was in counseling, just sort of did it all, and came and went as she was ready. And we were all there in each of our capacities. And it really just immediately comes to mind as such a success story in terms of staff trusting each other with the different parts we were playing, but also just watching this young person thrive and really demonstrate incredible amount of resilience through a lot of difficult moments.
And I think she was someone partly because like she had been sort of involved in different systems that aren't always the most caring and supportive, I think that it really helped her to see us trust each other, and us be, warm and friendly with each other and with her as we were kind of sharing her different services and being like, oh yeah, I know this person, of course, right, you're in counseling with Matt, I know Matt, and really being able to kind of create this more supportive space where it really did feel like those relationships were real and those relationships mattered.
And when she received her high school equivalency, we were all there to celebrate her together in the space. And I think things like that make such a huge difference. And I think are demonstrative of the community that SOAR is and has been.
Yes. Thank you so much for sharing all of that. I think we can all agree that the young people of New York are really, really lucky to have such wonderful and caring people supporting them. And I really love how flexibly you all talk about mental health support. It feels like such an important and key shift in the conversation, moving away from the idea that there's one way to provide or get support, particularly since we know that that doesn't always work for adolescents. So thank you again, Phoebe and Sarah. I want to shift gears a little bit now and introduce Dr. Erin Rush, or Tegan, or Dr. Erin as we all call her. Dr. Erin is a board certified psychiatrist currently completing a public psychiatry fellowship. She is newer to the door, just joining us this last summer. Dr. Erin is going to tell us a bit about how the door approaches integrating psychiatric support into our work. First, Dr. Erin, can you tell us about what makes psychiatry different from the other interventions we've been discussing this evening?
Yes, thank you, Lynette. I'd like to start by just briefly talking a little bit about what is psychiatry, what do psychiatrists do, and how does a psychiatrist fit into the mental health team? Because I think that distinguishing between all of the different types of mental health providers gets a little confusing. So psychiatrists are trained in both medicine and therapy. And so in many ways, we can kind of serve to bridge the gap between the two. Because the relationship between physical and psychological health can be really complicated, it sometimes requires like a really collaborative effort. So if someone's feeling really tired and unmotivated, I can kind of take a step back and look at the big picture. Is this depression? Or are you having an issue with your thyroid? Do we need to look into other medical conditions that could be contributing to the way you feel? Do I need to, talk to your primary care provider, send you downstairs and we can, evaluate this further. Sometimes we need to prescribe medications, and I like to think of that as providing the young person with an extra tool to help them work on what they're going through and to help them work on what they're working on with their therapist.
Thank you so much for sharing that, Dr. Erin. I love that idea of an extra tool. How do young people get connected to you?
I get referrals directly from the counseling center, and I also get them through Phoebe and the collaborative care team. Although we're working to expand quite a bit to reach more young people more recently. Right now I'm getting referrals from Runaway and Homeless Youth Team, the Bronx Youth Center, and BSA, which has all been really great. We've been really working to expand access to make sure that people are being identified and are getting into the programs that they need and get that extra support and care that they need. So there's been a lot of creative thinking around access and how we can get the best support to those young people. If we have the capacity, we really want to make sure that we can get people in as fast as possible.
That's so great to hear, Dr. Erin. I'm wondering if you could tell us a bit about what you've been seeing lately or how the pandemic has affected your work with young people.
So during the pandemic, social media has been such an important social outlet for young people. And I've really had to brush up on what's going on out there. Actually, they've been teaching me what's going on out there. So TikTok is this new platform that has come out and just exploded. And so it's really been shifting the dialogue about mental health with young people. There's a whole conversation happening out there on TikTok about mental health. And it's like been really great, but in some ways it's also been challenging as a mental health professional. So I'm seeing a ton of young people coming in, like self-diagnosing themselves, saying, I saw this on TikTok. And it's in a lot of ways been very great, because I think people are getting to know more about mental health. It's giving them the opportunity to learn, and then they're taking that knowledge and then bringing it to a mental health professional, and then we can talk about it more. And so I've really been enjoying this conversation that's been happening. I really think it's also helping to break down stigma around mental health, and helping people get support they need. People are stressed and they're looking for help.
Yes, Dr. Erin, social media, the gift and the curse. What's different, Dr. Erin, about psychiatry at the door?
I think it's really great that young people have so much access to us. So through the electronic medical record, they're constantly reaching out, asking questions. I've actually had some young people sending me like videos that like we can talk about it in session. I've had people bring their TikTok videos and like say, this really inspired me. I really connected with this, and like let's talk about it. It can help them explain to me what they're going through, which is really great. And I think that type of less formal interaction does a lot to help build trust and establish a relationship, which I've really loved. Because psychiatry gets so many referrals from so many different sources, there are fewer barriers to accessing care than in other spaces. Some of the other things like telehealth has been great. It's really also helped to remove some of those barriers. I can talk to a young person like when they're on the train or they're on their way to work. I can catch them briefly in between obligations. Sometimes they're working 2 jobs, they're going to school, and I can catch them, and we can at least touch in and check in and just establish, like a space. Let's see, a few more things. I think having multiple ways to check in has been really crucial. If a person doesn't have minutes on their phone, which happens a lot, they can come into the door, they can use the door's phone, or they can get set up with video there. If they find Wi-Fi, they can just make an internet-based call to me. We can do Zoom, or they can come and we can meet in person. So having all of those options, I think, has been really important to help improve access and help make that connection easier. One of the things that I really do love about the door is that how collaborative it is. It's been easy for me to reach out and talk to a young person's provider, their therapist, their school counselor, social supports, in a way that doesn't exist in other places. It's like truly the best model for improving mental health care. And everything I do is so much more powerful and effective because it's being reinforced across the whole building. And we can all be on the same team for that young person.
Yes, Dr. Erin, opening the door, no pun intended, and breaking down barriers. Thank you so much for sharing how psychiatry fits into the continuum of mental health support for young people at the door. It's great to have you as part of the team, Dr. Erin. I love your point of view about collaboration and supporting young people. And actually, that's a great segue because it leads me to introducing Meredith Sofrin, who is the Dean of Social Services at Broome Street Academy, the charter high school that is embedded and co-located at the door. I know there's so much overlap in supporting students. Meredith, how does BSA fit into this continuum we've been talking about?
Hi, thank you so much for having me. I'm really excited to be here and to share a little bit about Broome Street Academy. So we're a charter school, a pretty small one, and we're housed in the door. We have a really, really unique situation in that we are a high school, but we have a really robust mental health department that includes 3 full-time social workers, and that also includes some staffers from the door who work part-time with Broome Street Academy students only, which is lovely. And then we also have some folks that do door and Broome Street Academy student therapy as well. We have several social work interns, and this really huge, I would say, mental health department for such a small number of kids is truly unique in New York City. There's schools that have far more kids than we do, that have far fewer social workers, but our providers really are able to provide clinical counseling to our kids, whether they have an IEP, whether they have a counseling mandate, or whether they're just kids who have self-referred themselves for counseling, where were referred by their caregivers or teachers. Our work with the door is so exciting, especially this year. We've really deepened our connection to the psychiatry department. I want to echo a lot of things that Dr. Aaron said. We're really collaborative with them. We're able to refer kids immediately, whereas prior to this year, or prior to this year, but also just in other situations in other schools, it's really hard to get a student referred for, a higher level of care for psychiatry, to get them a psychiatric evaluation or ongoing care in the community. But here at Broome Street Academy, I can literally walk a student down and have them meet with somebody in order to provide them what they need in the very building that we have our school in. And it's something that's so special and so meaningful to a lot of our students and our families as well. I'll just share one brief example. We have a student who was working closely with a school counselor and also with the psychiatry department. And we were able to do a case conference with the caregiver, with the student, with the psychiatrist and the school counselor. And it was a really beautiful way to collaborate and also do some psychoeducation for the caregiver who was learning about what was going on for their students. So we were able to do all of that in the school building. And that felt really amazing for the kid because they were able to see everybody sort of gathering around them in the moment.
Thank you for sharing that, Meredith. I know, like many, the past 2 years have been so tough for schools in particular, and you all have worked so hard to make sure that you continue to support students. What has the past 2 years been like?
The past 2 years have been absolutely fascinating, beautiful, and also pretty painful for many of our students. It's starting, 2 years ago when COVID first hit. A lot of our kids were, I'd say, some of the families that were hit the hardest in the city. So there was a lot of loss. A group of really intrepid school counselors became bereavement counselors, which was really, really shocking. But it was also a tremendous way to kind of gain skill when it came to doing clinical work. Our students were remote. They were definitely struggling without being in the building. But at the same time, because we have so much mental health care, we were able to do so much fantastic outreach to students and to caregivers. And the social work team became really a backbone of the school. There was a lot of work going on, with the academic team and the teachers. But what we found was that we were so lucky to have so much therapeutic intervention during that time. And it's actually changed the way our kids view mental health. They've come in referring themselves, they've come in more self-aware, like what Dr. Aaron was saying about TikTok. They have become familiar with diagnoses, they've released themselves from the stigma of what it means to have a diagnosis. And they're able to just march into my office and say, Safra, I really need counseling. And I'm allowed to just give it to them. And it's different than it used to be. It used to be we had to find the kids that needed outreach. But now I don't have to look anywhere. They just come to me. That's really sweet.
Wow. Thank you all for sharing. And thank you, Meredith, for talking about your work at BSA. I've always been impressed by the door's approach, but hearing you all talk about your work and philosophy is so incredible. You've all really highlighted that mental health does not stand alone. Supporting young people is so much about integration and collaboration, things that you all are doing so beautifully, even during such challenging times that we're still going through today. I heard someone recently refer to the counseling garden when they were talking about mental health support at the door in the early years. And I still get the sense from all of you that it's all about building community and connection and really focusing on trusting relationships. I would now love to open up the floor for any questions. Feel free to drop them in the chat and we can help get them to the right folks to provide an answer. Okay. I will open this question up to any of our panelists. Bailey says, I understand that during the pandemic, it was challenging to stay connected to young people, but what are some of the things that have worked that you will keep doing? Anyone can answer.
I can start. So one of the things that I think has been helpful that we'll keep doing, that I've been involved in, is the text line. The text line was created during the beginning of the pandemic, and really allowed us to connect to young people that couldn't come into the building or just really needed to know that we were still around and point them in the right direction. So sometimes that was a check-in. Sometimes it was point us to the right resource. We also had caregivers reaching out. The text line is something that the door will continue to do.
I was just going to say, I think we found a lot of success with telehealth in the mental health side of things in particular. I think obviously with the medical side, there are a lot of things that we can't do remotely if somebody needs their blood drawn, if somebody needs an exam. But we found with therapy, the young people are really responding to the more flexible scheduling, the ability to be somewhere where they feel comfortable and safe and maybe don't have to commute, an hour and a half for their 45-minute appointment. And we found that our show rates for therapy have really gone up since we started doing telehealth. People really show up for their visits in a way that maybe it was harder for them to do before. So we have been bringing people back for in-person sessions as well. And it's been really wonderful to see them in person. And that dynamic is, different in its own way. But I think we really want to keep telehealth as part of our offering and part of our toolkit.
Thank you. There are teenagers, this is a question that came up. There are teenagers, and the person said, I know they must be hard to keep track of. What have you found that really works to make sure that that they stay connected to services? Keeping track of teenagers and services.
I can, so this is I would say my whole job is keeping track of teenagers. I think the one thing that's most important is the relational piece. So having them creating healthy attachments with adults in the building is the thing that's going to keep them coming back. That's the carrot. And if they've created any kind of warm regard with an adult, that often changes everything. And even if they, come for a few sessions and then skip out and then they come back, there's work that's done there in that relationship that's the one thing I'd say that can actually work.
Thank you, Meredith. Phoebe, someone asked, you mentioned getting a mental health license or accreditation. Can you share more about that and what that will mean for how you deliver services?
Sure. So it's still kind of in early stages. So I don't know how much to share necessarily, but there are just different licenses in the city for providing healthcare and mental health care. So right now we are sort of in the primary care space and are looking to move into the more specific outpatient mental health space. So it would just give us a chance to kind of have more of the services we have, to expand some of our crisis services, some of similar to collaborative care of a lot of the work that we already do at the door and that we really have built in, but finding ways to kind of formalize it and also be reimbursed for some of it.
Excellent. Thank you, Phoebe. Meredith, can you speak to the ways you've reached out to BSA students during the pandemic?
Absolutely. So there were different ways that we reached out during different stages, but I would say at the very beginning, for the first 6 months or so, we divided and conquered. We really had every staff member on deck making phone calls to students and caregivers almost every day. If they weren't on a caseload with a social worker already, the dean's team reached out, and teachers that didn't have the physical education teachers and things like that were able to reach out every single day. So we made really important and deep relationships, I'd say, with families and students alike. And that carried over into our hybrid model. And then now in person, things have been absolutely better in terms of the relationships between, I think at one point in 1 month, the 4 social workers made 600 phone calls to caregivers and students. that were actually answered. So it was a really amazing, amazing time.
I think this question is wonderful. I was actually thinking about it, listening to everyone speak. And I'll open it up to the panel. How does the door help support the mental health needs of its mental health providers? What support have you found at the agency, and what has been helpful for you?
I think we really do our best to provide good clinical supervision. We have group supervision within the counseling department and individual supervision where we can kind of talk through difficult cases, talk through, the beginnings of burnout and what we can do to help stave that off when things are as hard as they are. And as I mentioned a little bit earlier, we have this building-wide support space for all of mental health providers. So it's folks who are doing therapy, but also all of the embedded social workers and mental health counselors in all of the departments, where we can really learn from each other and brainstorm together and kind of build community in that way. And I think being able to rely on each other to support young people and even to support, ourselves is a really important piece of the door.
I'd also just like to add that goes beyond, we have lots of space for licensed folks and social workers and other departments, and we try to go beyond that to just all staff, right? We all kind of working within the same building, the same system, and working with the same young people. So making sure that we're providing support to all staff to process the things that they might be hearing from young people that they're experiencing in the space, and supporting the mental health is like pausing when something big happens and making sure we're acknowledging it.
Thank you for that. Can anyone on the panel talk a bit more about how peers of young people can help with this work?
Yeah, I'll start by saying that we have an amazing youth leadership program that takes a lot of the work of peers supporting the young people within the space. And one of the things they do is really by communicating with youth and the other youth and the young people in the programs, and modeling communication and regulating of emotions, and just being that model young person, though they're also going through things and they also struggle sometimes. And we also have to support those youth leaders, and they're making sure that they're passing that on to other young people within the space.
And I think part of the great work that our peers do is bridging that gap. If somebody's maybe reluctant about services or nervous or anxious about connecting to care, if their peers have had that experience before or know the staff people or kind of can give them a little bit of guidance about what that's going to be like. Sometimes it's helpful to come from somebody who's a little bit more trusted or who's, going through the same lived experience as them.
Thank you. From a substance use perspective, how is substance use showing up, and how are folks at the door working with young people to address substance use?
I can talk about this one from my perspective. Substance use has definitely been showing up a lot, and I've seen an increase in it, during the pandemic, just with the additional stresses that people are going through and, limited coping skills. Substance use has really been increasing. And so I think marijuana use is really, I see a lot of alcohol, not so much nicotine anymore, but those are really the two big two that I've been seeing. And from my perspective, I think a lot of the young people that I see are still they have never been on psychiatric medications. They are not super familiar with psychiatry. And so I usually really take things very slow and try to educate them on like, what are your options? Like if you need, like an aid to help you with if you want to stop using marijuana and you need an aid to help you to work through this for a short period of time, then I'm here to support you with that. And I do a lot of motivational interviewing, kind of working through feelings about, substance use and pros and cons, medications, and working from that perspective.
Thank you, Dr. Aaron. That was our last question from folks in the room. Before we end, I just want to ask the panelists. We talked a lot about the importance of collaboration and integration, meeting youth where they are. Looking at mental health at the door, can you end with one word from your perspective on your work with mental health at the door in your work with young people? I will ask Sarah, one word.
Wow, you gave me the hardest task so far. One word. I used the word earlier. I'll say resilience.
Thank you. Phoebe.
Authenticity.
Meredith.
Fun.
Steph.
Compassionate.
And last but not least, Dr. Erin.
I'm going to say impressed, but I'm going to cheat a little bit because I've just been impressed by the resilience that I've seen. So
Nice. So I'm sure we could keep this conversation going all night, but it is time to wrap up. Thank you all so much for joining us. And a huge thank you to our wonderful panelists for sharing your wisdom and your work with us. I hope to see you all soon. Have a great night.